Okay. All right. Good evening, everyone, and welcome to the regular monthly meeting of the Health and Human Services Board for June 26th. First item of business is call of the roll, and I think the record should show that all members of the Health and Human Services Board are present. We have a set of minutes from our last meeting, which was May 22nd. You have those in your packet. Any questions about the minutes? All right, I could use a motion to approve.
I so move, Your Honor.
And then Dr. Hall will second. Mr. Steen and Dr. Hall. Any additions or corrections? Additions or corrections? If not, all in favor of approving the minutes, say aye. Aye. Any opposed? Minutes for May 22nd are approved. We do have a written public comment, and do we have an oral public comment? Dr. Vetter, please. You know the drill, right? Just flip on the mic, the little.
Right side, there you go.
Okay.
You're good.
Well, thank you for allowing me to do a public statement.
Of course.
We also, Steve and I also received that letter that you all received. Steve Carlson from Trago. And he's asking, and we're asking for a delegated authority for Dunn County to inspect manufactured home communities. We currently have on this list that he was sending you 26 of these homes, and actually only 14 are active. And Steve has done some research on 3 of the manufactured home communities, and the only one that was actually having an active license was Shady Oaks. And that's that trailer court that, as you're going south on 25, is about 2 miles south of Menominee, and with a lot of dilapidated homes. That is actually an active trailer court. But then we've got one across from the library, which is Evergreen Isle. And we've got the one just south of Menominee on 25, Birch Terrace, that both of those are inactive. They have not been renewed. So I've always thought that Birch Terrace looked nice, but they've had frozen overflow drain fields with sewage backup. They've had sand in their tap water, and there's been a failure to remove these homes that are dilapidated, surrounded by trash. Shady Oaks has the same problem. The people in Evergreen Isle that were contacted by Steve and his group of 5 were concerned about the dilapidated and abandoned homes. And that's right in our own community of Menominee. So I'm really very pleased that these 5 people canvassed the residents of these communities. I met the 2 that came up from Madison to help out Steve and his group. And they're just, exceptional people. They came back and they talked to me and they said, there's a lot of people concerned. They don't know where to go to get help. They don't know how to access the system to get inspections. And they are concerned about the bad conditions with their sewers and their water. So I think we need to do something for these people to help them out, and they won't have the burden, the responsibility, or the risk, of losing their spot in the mobile home courts, if the county takes over inspections. And I think annual inspections to look for their safety and their concerns, should be done. We have a responsibility as a community to take care of other people in our community. And I'm going to just have Steve also give his opinion.
Right. Thank you, Lorraine.
I do not have much to add other than.
Excuse me, Mr. Hogseth.
Sorry, point of order. Should their addresses be?
Yes, and I was just thinking that I should have asked for names and addresses.
Yeah.
I'm sorry, Lorraine. I need to bring my brain to work.
They complain about me at the city too when I do this. My name is Lorraine Vetter, and I live at 515 21st Street North in Menominee.
Thank you. Mr. Hogseth, the same, please.
My name is Steve Hogseth. I live at 614 Woodridge Court in Menominee. And Lorraine pretty much gave a summary. She and I have talked about this since the last meeting, and I support what Mr. Carlson is trying to do and support the comments that Lorene just stated. And I know this puts a burden, additional burden on the county. I'm aware of that. And it affects staff and it affects budgets. But please give this due consideration and see what we can do to help these people. Thank you.
Thank you, Steve. Did everyone receive a copy of Mr. Carlson's letter? All right, then I'll read it. From Steve Carlson, Tuesday, June 24th, to public comment. To Dunn County Health and Human Services Committee, dear HHS committee members, my name is Steve Carlson and I live in Trago Township in Washburn County, Wisconsin. I'm board president of the Wisconsin Manufactured Homeowners Alliance, a nonprofit registered with the Wisconsin Department of Financial Institutions and fiscally sponsored by the Wisconsin Farmers Union. And he gives us a website, which yeah. I'm writing to encourage the committee to explore applying for delegated authority from the Wisconsin Department of Safety and Professional Services to annually inspect manufactured home communities, parens, MHCs, close parens, often called mobile home parks in Dunn County. This would ensure that community owners have active licenses and are compliant with licensure requirements regarding health and safety concerns. Attached below are 3 documents, which I believe were in your packets. One, a letter from the Wisconsin Department of Safety and Professional Services, DSPS, Section Chief Kirk Rutan, in response to several questions I emailed to him over a year ago. 2, the most recent master list of manufactured home communities in Wisconsin, downloaded from the DSPS website a year ago. And 3, a DSPS delegated authority welcome packet for county health departments. In the letter from Mr. Rutan, you will see that DSPS does not annually inspect MHCs, manufactured home communities, unless they receive a complaint. You'll also see that DSPS does not guarantee the anonymity of a complainant, nor do they provide any whistleblower protections for complainants. This is problematic in that, from our recent experience knocking on doors in multiple MHCs in Dunn counties, residents do not know where or how to make a complaint and express a fear of retaliation, real or imagined, from community owners should they make a formal complaint to an official entity. Proactive annual inspections by the Dunn County Health Department would relieve MHC residents of shouldering the burden and risk of having to confront community owners individually. In the most recent master list of MHCs, you'll see that 6 manufactured home communities are operating with an expired license. I've knocked doors recently in 2 of them and can attest that there are people living there. Mr. Rutan addresses the issue of license expiration in his letter to me, suggesting there may be a lag time between their internal and public-facing information, and yet a year later, there are clearly MHCs operating in Dunn County with expired licenses. Below is a link to the e-license lookup page on the DSPS website, presumably current, which shows that there are still MHCs in Menominee/Dunn County operating with expired licenses. And he gives the website address. In the last 6 weeks, we have heard stories from Dunn County residents living in MHCs about water, sewer, septic quality issues and concerns about a failure to remove abandoned, seriously dilapidated homes, sometimes surrounded by large trash piles. There are children living in these communities. The worst story we heard was that last winter, the septic system failed in a large community just south of Menominee, resulting in raw sewage backing up through toilet bowls, bathtubs, and flooding several people's homes. Again, annual proactive inspections by the Dunn County Health Department may prevent these kinds of obvious health and safety hazards from happening in the first place. Your neighbors to the southeast and northwest, Eau Claire and St. Croix counties have delegated authority to inspect MHCs and would be a ready resource to answer any questions you folks might have about cost, staff time, benefits, etc. In summary, I hope the committee will strongly consider applying for delegated authority from DSPS to annually inspect MHCs in Dunn counties. These communities are often populated with some of our most vulnerable neighbors, i.e. senior citizens, people with disabilities, and people of color. In fact, we spoke to many Hmong families in one large community just south of Menominee. Cultural, language barriers, apathy, and fear can keep people from speaking up about legitimate concerns. Annual inspections by the Dunn County Health Department would lift a burden from the shoulders of those who shouldn't have to bear it in the first place. I'd be happy to speak to any committee member if they have further questions. Thanks for the opportunity to weigh in on this issue. Steve Carlson, Board President, Wisconsin Manufactured Homeowners Alliance, and he lists his address and phone number. We do have this on the agenda as a discussion item. And we only got this yesterday. You do have some, you do have.
Do I have access to it somehow?
You do have some materials in some on the desk.
I have I have from the Department of Public Health. I have those.
Some of it's the same.
I'll have access to the whole pack.
Thank you.
Okay. Questions?
I've got a couple questions if I could, please.
Want to do it now, or do you want to wait till we have an actual discussion?
I'll wait till then.
All right, Ms. Rudy, thank you. All right. Our next meeting date is the 24th of July. We're all good? That's a regular meeting date. I think this one was like a week later. Whatever, never mind. It's just me. All right, this is a complicated issue that deserves some attention. And I've put it on the agenda because I think it has multiple ramifications. Needs some pretty serious and robust consideration. And so I've put it on the agenda as an item at the request of the chair. KT has shared some materials with you, and I'm going to turn this over to KT and Paula or KT to carry this discussion. Please, KT.
All right, so I do want to go ahead and share my screen so that you guys can see exactly what I hit it out via email earlier today, but so that we can have that conversation. Right. So item 6A, to kind of tee up the conversation, I did some background. My team has spent about 20 hours on this in the last month as an idea of starting place. For those of you guys that did not sit on the hiring committee, just to give you a quick idea of my background. So I worked as the environmental health manager for 5 years at the Eau Claire City County Health Department, meaning I ran this program. During that time, we had some significant challenges with this long-standing program in Eau Claire that resulted in the county taking over by force Maples Mobile Home Park. It resulted in homelessness, and it resulted in a significant amount of time for the team, as well as for our city attorney and others involved in case management, supporting folks finding homes outside of living rough or living in their car. And so that was really challenging. And so I want to bring that experience to bear. Also in this update, what you have in front of you is the statute, which was also referenced in the materials from the public comment. you have an indication of what the the DSPS fees are every 2 years based on size of mobile home community. Communities are not required to be licensed if they are at less than 6 houses or 6 mobile homes. And so some of those very small ones in Dunn County likely are not licensable. I do raise, and you see that in the document, the concern that what is listed as licensed on the DSPS request for information is not the same as what our municipal clerks reported and is not the same as what our Dunn County zoning. So there would take a significant amount of time, just really kind of putting our thumb on who is licensed, who is not licensed, who should be licensed. And then there's also going to be, I would say, some political pushback, just to little p politic, about those folks that have not held a license for quite some time and have never been licensed. So also in what I provided, so you see those numbers there. Again, significant discrepancies between the 9 actively licensed MHCs for Dunn County and what the different municipalities reported. As I shared, yes, I do understand the Eau Claire City County Health Department and their long-standing early 90s delegation and contractual relationship with DSPS. Every other health department I spoke to and zoning, if they had any kind of local licensure, had been doing this for quite some time. And so when I spoke to Superior, when I talked to St. Croix, when I talked to Wood County, these have all been in place since for forever. What I didn't find is a recent instance of that implementation and startup cost. When I spoke to inspectors whose hair is a little grayer than mine, that I still have access to their personal phone numbers, they shared their experience some 30, 35 years ago, and that it was significant. It does take an incredible amount of time. It's a big lift to get this program up off the ground, in that many of these mobile home parks are not up to code. And the building code that applies to mobile homes is different from the uniform building code, in that many of them are not considered repairable. And so what ends up happening when you bring something into compliance, that there is the unintended consequence of removing some of these homes. It may be that they are not safe and sanitary. And so there may be that on balance, it needs to come out, but sometimes not. So again, these are just things for you to hold tension around. And when they're removed, oftentimes the footprint is not sufficient to accommodate a new mobile home. And so what I heard from several different locations is that many of these, upon becoming licensed, they lose home sites by attrition, meaning it's not repairable, it's removed, nothing else goes into its place. Also sharing that in Superior, so Douglas County, they had a mobile home that the county is the proud owner of. After 3 years, they raised it and removed all of the mobile homes in that park because of significant issues around sewage and backup. And because those things could not be remedied, and because the owner passed away, and then the folks that they left it to did not pay taxes, it then became part of the county's portfolio. And instead of repairing, that's what the county did with that particular mobile home park. So not that unlike Maples in Eau Claire. Otherwise, the day-to-day implementation is, or maintenance, rather, the day-to-day maintenance of the program is relatively covered by fees. You are able to set your own fees. If you have ordinances that allow you to do so, we would need to update ordinance, obviously. DSPS is challenging in that it requires a 37% reimbursement on their licensure. So in addition to what we would need to recoup our costs, we would also need to spend that back to DSPS. And in the DSPS regulations, you are only allowed to charge for direct cost, meaning overhead for the inspectors to do the work is not eligible for total costs. And so you know that we do 100% time tracking, and we could account for those direct costs, but it would not account for my time, their computers, the electricity, all those other overhead costs that go into an inspection program. We face that currently with the other DSPS program that we're licensed agents for, which is body art. And then, of course, just to kind of cap that off for your awareness, I did have a conversation with Corporation Counsel. He reads it the same way I do. Indeed, health departments are the only licensable, or rather delegatable, organizations. And I do believe that is because health departments bring a different lens to the work that we do. And we are thinking about harm reduction. We are thinking about housing as a social determinant of health. And we are thinking about, on balance, what is the best way to approach this whole community issue. So that is what you have as far as background information. Because this is a discussion item, how else would you like me to handle that?
I know that we're going to have some discussion and I interrupted Miss Rudy earlier, so your questions, please. And thanks, Polly.
And I think KT kind of brought up a couple of my concerns. I think on the periphery, it sounds like it's something that everyone would be in favor of. I guess my concern is unintended consequences of eviction. Once you go in and find a home's uninhabitable, where do these people go? We've already discussed through the county that we're lacking housing, and I know that shelter care is limited by far. And I also worry about the costs of the program that goes to the landlords or the owners of the trailer court. They're clearly going to pass that cost on to the tenants. And so it's just kind of the unintended consequences, I think, that I am concerned about on that end, if I'm understanding you correctly.
Thank you. Yeah, Dr. Hall.
Okay, I have a lot of thoughts, and I want to thank you, KT, for giving us a lot of background information. This is something that I've been thinking about and reading about ever since it was brought up at our last meeting. And I spent some time reading through the state statute, and I'm certainly no legal expert, but I found a couple of things that perhaps they're questions that you can answer, perhaps no one here knows the answer. So the first thing is in the information that you gave us, you mentioned that some places are kind of grandfathered in, yet in the statute, in the section under scope, it says that the statutes apply to all new and existing mobile home communities. So that was confusing.
Sure, absolutely. So when you see grandfathered in the one-sheeter that I provided, that's for municipal permitting under zoning laws. And so you're absolutely right.
So there's municipal permitting and state
yeah.
licensure.
Yeah.
So we have two different things happening.
So kind of like you
Okay.
have a liquor license with your municipality, but then you also have a retail food license with the health department or Department of Agriculture. Does that
Okay.
make sense?
Yes.
Sure.
Okay.
That answer your question, Dr.
That answers that question. Can I
Oh,
say
yeah,
my other
please.
things? Okay.
Please.
So the other thing that I noticed reading the statute was that these MHCs need to renew their permit or license every 2 years, but it does not specify any criteria or that any due diligence on the part of the state to make sure that they are still following the letter of the law is required, which also, to my mind, brings up the issue of, well, why isn't there something in there as we think about potential solutions or something that, because this is a terrible situation. I just want to this is a terrible situation without any easy answers.
I think we all acknowledge that.
But maybe we wouldn't have gotten here if the state was actually enforcing their own laws. And so that was kind of the other thing that came out to me in this is that there's no accountability, there's no follow through. You get permitted once and then we don't care if you don't maintain your license. We don't care if you don't maintain your permit. The letter that Mr. Carlson got back that I just read seemed very unsatisfactory in terms of, are these places, do they actually hold an active permit or not? So to be honest, I'm feeling a little upset with the state for dropping the ball on this. And so I wonder if that
Frequency.
might be another avenue for, problem solving around this issue. And then I also want to agree that certainly, especially at a time when there is such a housing shortage, when there's such an affordable housing shortage, perhaps a subpar home is better than no home at all. And so I'm, as I was thinking about this really difficult situation that is unacceptable, and then thinking about how becoming a delegated authority as a county could have a lot of upfront expense for our county at a
Correct.
time when our other revenue sources, many of our grants, all those other things are drying up, and the needs in our county due to the loss of other types of government supports are increasing, is not great timing for us. And it wouldn't necessarily be great timing for residents to suddenly find themselves unhoused when their SNAP benefits have just been cut and other things as well. So I was trying to think about what can be done to support actions to improve the quality of housing. So there was talk last time about co-ops, right? Or advocacy groups or educational interventions for residents that they do have the right to make a complaint. It's very unfortunate that it is not anonymous, that it's not, and so I understand that is not ideal in terms of the fear of retaliation. Absolutely. And then also, I think it brings up, and I would be very interested to hear what the housing action team, and I think there's folks here who could speak to that in terms of how we increase housing supply in our area. Every time I go to Eau Claire, I'm so jealous that they are building so many new apartment buildings and so many new homes, and it's not happening here. So, and my understanding is it's not for lack of demand. So what can we do to increase the supply so that then there's not such a affordability issue?
Those of us who've been working on this housing issue for 5 years,
Yeah,
6 years, this is a very big onion.
yeah.
And every time you peel one layer, it turns out that there's another entire layer of problems and issues and ramifications. This is a big issue for us at this time, and thank you for pointing out just a few of the ramifications
It's welcome to the party,
that we
you're
have
saying?
to deal with.
Yes,
Welcome to the party,
welcome
Dr.
to the
Hall.
Party. But it also makes me think about if we can't advocate for improvements in how the state manages this process, or maybe work with our state legislators to say, hey, this is an issue, you guys have dropped the ball here. Perhaps planning for an eventual delegated authority, planning, working, partnering with the owners of these communities who I don't know, maybe they're evil landlords that are making tons of money off of people, but probably not, right? They're probably trying to make a living just like anyone else. They probably don't like having that big eyesore abandoned, trashy place in their park either. I don't know. But, thinking about how can we partner? And I think there's other people in the room that probably know a lot more than I do about potential avenues for that. So I think I'll
In
I'll
the
yield.
research that I've done this week, it does.
You're not on.
I thought it was on, that many of the owners of these manufactured home communities are out-of-state investment firms. Just saying, another layer.
So it's not my, fellow Menominee citizen who's trying to make a living, and there are some, but there's also some just evil corporate landlord investment people. I don't know.
I know.
I don't know.
I didn't touch it. Supervisor Bishan.
So with this, now mobile homes are not very mobile. even though the name says that. So is there any recourse if their standards were not up, from the owner just saying, well, I'm closing the park? Can they just be like, well, we're closed, get your home out? Because in our zoning ordinance, our zoning residential units are not friendly for mobile home parks. So if you're in an R1, you can have a mobile home if it's of a certain age. R2s and R3s both require special exemptions. So you can't just pick up your home and find a place and buy lots, because we have so many of them, and just plop the house down.
Can you
So-
speak to that, KT, and maybe talk a little bit about the cost of moving
So it is,
manufactured homes?
it is significant. And many of these are old enough that they, like you said, are not conducive to moving. Even putting them on a trailer and moving them
Fall apart.
can result in the lack of structural integrity. I think I would love to hear what zoning has to say about that, specifically about how things work. And I know that Tammy and I did sit down and very happy to work together on kind of how this moves forward so that we're working in collaboration. But I think that you brought up a really strong challenge. When the park closes, oftentimes there is no recourse. And so listening to the Douglas County Health Department talk about the park that was reclaimed, one individual did try to move their trailer, which they owned, and it did fall apart, literally in transit. And that's after they had worked to find a location for it to go to. So to say that it takes a significant amount of case management is an understatement.
Supervisor Breslin.
Hey, KT, let's say we go forward with delegated authority, all right? How much autonomy do we have to run this program as we, Dunn County, see fit versus the pigeonhole of what the state requires?
It's a great question. So we are required to use the state form for inspections. And so that really is, I would say, vague. So maybe there's some space there. And there is the opportunity for localizing ordinances if there is interest, if the board has interest in doing so. We are required to adopt SPS 326. And so we can't be, so that's one of the links that you have in the documents that are emailed to you. That link is live. And then we also are required to follow specific enforcement guidelines and reporting guidelines. And those are all laid out in state statute as well. So I think there is an opportunity, just like we do with our DAC cap contract, to localize it to meet our needs. We definitely would have the ability, especially with the oversight committee here, to make sure that we were doing the inspections that we are required to do instead of just taking the money and not. But, I think that's a long process.
Yeah.
I've updated codes before, the housing code in Eau Claire City County Health Department. When I worked there, it was a 3-year process to update the housing code to reflect the APHA model housing code. It involved a lot of stakeholder involvement. It took a lot of public hearings, and obviously it was iterative. So it had to go through many different lenses to make sure that it passed the city council at that time, because it was a city county health department. And so I would expect that, yes, we can do it. Yes, we can localize it. It would take a minute.
Other questions, Supervisor Steen?
Yeah, I would suggest that we move slowly on this. I would be interested in getting the estimated financial impact that it would bring to the health department. And then also the impact of the additional fees on the owners of the trailer park. What kind of impact would that have?
Mhm.
So that we can make as an intelligent decision as we can before we open this can of worms. And I share Dr. Hall's jealousy of Eau Claire, but I'm going to hazard a guess that all those new apartments are not affordable housing. They
Some of them are.
Well, some are, but
Some of them are.
the majority are out of. I'm going to hazard a guess that they're out of the reach of the people that are living in the trailer courts. I'll put it that way. So
Sure about that, but that's another item. Supervisor Hagan.
thank you.
Thank you. Two questions. One, would there be any ability for the county to work with the local municipalities? Perhaps, I think there is a ability to do deputy inspectors with different members, not for this.
Statute says health department.
Correct.
And the health department does not have the ability to do the deputy inspector?
I don't have the ability to delegate authority outside of my agency.
Okay, all right. Then my other question with that would be, well, question is when we're talking about making sure to do this diligently and everything, I can see this as in the housing program further on down the line, making sure that we have the housing stock available for any potential displacements that may come from this, and having that type of structure in place before moving forward with delegated authority, just to have that cushion there. And in the meantime, I think the HAT team could potentially work on an educational campaign for these manufactured home communities to help get the word out as to what what their rights are, what their protections are, and how to like safely do their own inspections of their properties.
That actually might be a task for GROW as well.
Fair enough.
The reason I put this item on as a discussion item is that the ramifications, as you all are recognizing intelligently, are big. I think this needs to also involve, at some level, county planning and zoning. We need to look at budget implications. We need to look at the, spillover ramifications for our low income and unhoused population. So we're not dismissing this, but we're not acting on it. And KT and I and Paula will work on ways to bring this back to us for discussion. Is that okay with everybody? Any other comments before we move on? All right, thank you. Thank you very much, and thank you. Item number 7 is up, Veteran Service. Are you ready, Greg?
Good evening, supervisors, citizen members. I'll start off my report. The reporting on the month of May, we participated in a Memorial Day event, and I think I'd already briefly kind of went over that just based upon the timing of last month. Health and Human Services partnered, I believe it was with public health staff on QPR training this last month. And I've been through it a number of times, and so I kind of approached it as a refresher because it'd probably been about five years. So it was good training. I think it's always a good thing for anybody to attend that, just to be able to be mindful of the signs and symptoms and really to be prepared in the event that if you see somebody that's hurting.
Yeah.
The other thing, of course, a number of housing-related activities going on, and attended the, I believe it was called the Housing Summit, and then I'm sure Paula will cover a bit as well with a very, very good behavioral health event where had a number of one vignette, number of teams that went around into different departments, and so it really I looked at it as an opportunity for other departments or other staff members that are maybe newer or haven't encountered our office, just to see how we conduct business in the event of a family that coming in need, because there's so many things that can be covered in one spot and those appropriate referrals and stuff. So I thought it was a good event. Glad to be part of that.
And, we really appreciate the fact that Veterans Services is engaging so collaboratively with other departments. It makes a real difference. And so thank you for that.
Very, very welcome. I think location of our office helps a lot to be really front facing so people don't forget about
Yeah.
us. So I
Could be in the
They-
basement.
well, right.
Hey, sorry.
The other item on the state related, I've already talked a bit about the spring conference and the purpose of our overall association is specifically training. Each service officer to remain accredited, you need to conduct 16 hours of continuing education. Those conferences satisfy that. Bring in all kinds of federal, state trainers. So that was completed. And then our leadership has been asked to participate, and we will be participating in with the Wisconsin Department of Veterans Affairs for the governor's interagency council on mental health. They're doing a bunch of listening sessions, and I'm sure that there's more than just me at this table that are going to be participating in those listening sessions. It'll give us an opportunity to really speak specific about what we're seeing as needs, gaps when it comes to serving the veteran community. And I have and this would be, speaking on behalf of the association, but also, individually, we're trying to capture from each region. Each part of the state is different populations, different cultures within. And, my thing that I'll be emphasizing a lot is really the individuals in my whole career that I've seen that suffer the most lack purpose. And that'll be that area. How that looks for each of us is different, but how do you fan that and keep that going for an individual, especially when you have we'll call it a change of mission, life event, and sometimes that's difficult to re-steady yourself and move forward with that purpose. So we kind of talking about that and giving some input. This month on the federal side, I'm just going to highlight quickly one benefit for educational purposes of why is there even a what's called a VA mortgage. So the overall reason for having a VA mortgage is to allow that service member that has been engaged in work and not had the ability necessarily to grow roots, to be able to grow roots quickly in a community. And the VA mortgage allows a veteran that qualifies to purchase a home at 100% of the value, or borrow 100% of the value of that home without private mortgage insurance, or PMI. They say without PMI, however, they roll it in for those that don't qualify for a waiver of that private mortgage insurance. They call it a funding fee, and it's a percentage based upon the loan. And it still is a great benefit. They roll that in, but you don't have that monthly 70 to 200 extra dollars because you're a higher risk, because you don't have the 20% equity that is asked of individuals. And you don't get a free pass just because you're a veteran. Debt to income, credit scores still all apply when it comes to this, but it does really allow an individual to start building that wealth. You purchase a home, you live in that home, that just in most instances, just that natural equity increase happens because it's lived in. And so that's that way for individuals to start building that wealth.
A lot of us grew up in VA mortgaged homes.
Yeah, it's a great opportunity for that. It's not there. It has to be your primary residence, of course. Can't be. Yeah, they don't. There's some certain caveats that I think can steer somebody into almost like an investment part, but most part it is primary residence. Get that family grounded, get roots, be part of the community, and not have to be renting because they've lived in, we'll call it inadequate housing for 2 years, 4 years, 5
Yeah.
years already of their life. And we have a number of local lenders that are they are originators of these loans. I only refer to local lenders because the internet world of dumping your information out and having 300 hits on your credit to get a mortgage, get a car, a lot, and that's that financial literacy that we're lacking. That's a whole nother discussion. But to go to those local lenders, see the whites of their eyes, bring in products, put in their hands, have them help you walk through because they're gonna take more time to educate and know the market best. And thankfully we have some. Our office will provide kind of what I've just done here, but in a more of an expansive method. I'll educate the individuals that are working towards this process the best that I can, and really tell them, make sure you pay your bills on time. Best thing you can do. And then in that preparation phase, but then there's certificate of eligibility. Used to be a big deal in the years past, but now with technology, very easy. Lenders that are participants can get that certificate of eligibility to prove that in real time. So it's really an improved process and program. So it's a great benefit for individuals just getting started. Any questions about that?
Any questions for Gray? Supervisor Hagan?
Hi, thank you. First of all, I drove past the ceremony on Flag Day and there was a good turnout there. So that was really cool to see. I saw some people honking, so it was nice.
Yeah. I participated in that as well. Yes. Yeah, it was nice.
Good. And then I had a note for myself to ask you, but I can't remember what it was. But I jotted down VSAP home program.
Say that again.
VSAP home, something to do with a home program.
That I'm not aware of, but what jumps in my head is HUD VASH, but we've talked about.
Maybe it was VASH.
That's subsidized housing rental program.
Okay, yeah, I was looking at the federal statement. I was trying to think of it. Maybe it was VASH instead, and how that would align with this, but they wouldn't cross in any significant
Transition. Rental to home ownership.
Supervisor Hagan, go ahead.
Oh, sorry. I just had one more thing, speaking about transition to, and about a change in life event, going back to what you said earlier. One thing I was thinking of randomly, and please humor me, is nutrition education for veterans returning home. Because I would think that being in the military, the meals are prepared in a sense. And so coming back to civilian life, that transition period, is there nutritional educational opportunities?
Yes. If
Food
they're
line,
if they're
going away.
if they're enrolled in the VA for healthcare, there's many opportunities. If you develop diabetes, they have a diabetic educator that will work with you. You don't want to get to that phase. If you want to decrease your weight, there's a program called, it's VA Move, MOVE. I do not know what the acronym stands for. So there's ample resources that do exist for a motivated individual that they do want to make some healthy lifestyle changes.
And that's something that when they come visit you in your office.
I've never talked to anybody about that, but that's a good talk about being healthy all the time, but not specifics about, hey, drop the Monster and leave the donuts at Quick Trip.
You're not wrong.
Yeah, it's and there's a culture within the military, and it is yes, healthy food, healthy lifestyle. However, that gets left at the first fill up of gas at the gas station because of just the young high. It's easy. Everything is set up to just easy grab and go, and none of that is healthy for us. And it does have, like with the energy it drinks, and not to elaborate too much, yeah. But when you go to an exercise hot area, you will, if you have a good first general officer, they will put out a memorandum that there is no energy drinks allowed in this training area. Because what happens is people do not prepare themselves, their mind or their body. They get out in a hot environment, have to pick up a axe and a shovel for the first time, and there'll be a heat casualty right away. It takes 2 days about before you're heat casualty. And so some of those things, there's a lot of education surrounding that. There is not one military base you go into and stand in front of a urinal or a toilet that you not see a urine color chart. You know, there it is.
Can we move on?
Sorry.
Yeah.
This is
sorry,
sort of
it was-
not-
it was getting,
This kind of not in
Yeah,
our
yeah.
purview.
yeah, I was just going over
Thank
the
you for the
transition to.
long explanation. Greg, please go ahead.
Round me up. The next item on the client serve report, I'll jump to the two impact statements. The first one we've talked to this, unfortunately, this family, it's taken a little bit of time to be awarded benefits, but the veteran passed away from a fentanyl overdose. And had been treated for a variety of things, and we'd been working with the family for a long number of programs through Dunn County, been working with the family, and it had just taken a little bit of time, and it is a good, it's a horrible event for the whole family. However, thankfully, there's a safety net for health insurance, for a fixed income, and they did own their home, a property tax credit, and it had been about a 10-year path for this young family from really bad times to home purchase. Things are looking good, and then just a stumble, and it has lifelong impact. But they've got that safety net, which is great to know. And then the other one you can read, but basically it is just kind of continually identify some of the ongoing challenges and mistakes that we have with some of the outputs from the Veterans Administration, which requires us to read through things closely, because there's lots of errors. And a clear and unmistakable error is just an overt error in law. And we've just seen a lot of them. And in this particular situation, there's actually gave them 2 opportunities to fix. They fixed it halfway the first time, but then they didn't read it all the way through. And then so we're going to get the other one fixed, which they're big mistakes, big
Yeah,
mistakes,
Big money
because
mistakes.
yeah, so that's just identifying that consistency in some of those mistakes. And there's a lot of reasons for that, but it will improve for the VA. Move on to the financial side. I do have a request later on that I'll go through, but in our overall budget, we're really looking at the midpoint. Do not anticipate any challenges going forward. The communication with our CFO and her staff, any questions, any discussions, they're always receptive to that. So that really makes it helpful, and especially we're going through the budget times to take an opportunity to discuss these things. So I don't have anything further to add, or any other rabbit holes to go down.
Okay, any further questions for Veteran Services? Thank you, Greg.
Yeah, thank you.
All right, we're moving on to public health. You have a staff report that came. So KT, go ahead.
All right, sharing that up on the screen because it did come to you fairly late. Just a quick overview, following up on the measles outbreak, we are starting to see some slowing in Texas because of the hard work of practitioners, public health practitioners and clinicians. So absolutely appreciate that. One of the things that I put up there in the graphic, people can kind of see themselves on a map. It's an easy way to data visualize. And so what you have in front of you is Texas with its level of exemptions in dark. In that middle graphic, the level of exemptions to kindergarten vaccines. And then you can overlap with outbreak by cases by county. So you see kind of where there are some of those really heavy dark spots. And then what I wanted to point out is that you can actually find something fairly similar in the DHS website about children at 2 years and whether or not they've had their MMRs. And you'll see, you can see ourselves on the map right here, that we are not the highest. You can see that we are at about 70 to 75% if you look at the county as a whole. And then there are some pockets where they are that lighter kind of mint green, under 70%. So the nurses just this week actually are starting a quality improvement project to talk to specifically some of our private schools that have very low immunization rates, AKA 45%. And so how can we meet them where they're at to get them the information that they need so they can make an informed decision about their families and then also know the risk. So, if you've been exposed to measles, even if you are vaccinated prophylactically, you still have a quarantine period. Do folks know that? So just know that this is something that keeps me up at night and something that we are working on. You also saw a very large national outbreak with listeria, resulting in several hospitalizations, 3 deaths, and the loss of a fetus, which is the nasty thing about listeria is that it does pass the placental barrier and can result in the loss of a wanted pregnancy. So, and this is one of those things that should be cooked before you eat them. So people are eating them without cooking them. And it took over a year for them to really pinpoint where it was coming from. So if it says cook before eating, for the love of all things, cook it
before eating.
And then there is a little bit of finance in here, just talking about what we know about federal grants. We are seeing a significant decrease in benefit to families for fresh fruits and vegetables. It resulted in a lag in our farmers market dollars for our families. And so we will see less money to our farmers and less veggies in our baskets here for Dunn County residents that participate in WIC. Put that on your radar. And then you will see some additional information around in the press release. I didn't print it out for you, but we did a press release on lead testing for littles. 2x2 is the new DHS campaign, and we saw such a reduction in families getting their littles tested for lead exposure through COVID. They weren't seeing their doctor, they were seeing their doctor virtually, so they weren't having those biometric tests done. And so we're trying to make up for that because we know that 46% of our housing stock here in Dunn County was built before 1978, and that's when lead paint was banned. And so we have a really good feel that there's a good potential for exposure. If you don't know, you don't know. And you can have lifelong impacts. There's also things that you can do for lead. So changing your diet, changing your exposure. And we want to make sure that we get that out into the community. So that's there, as well as the press release that you had as well. Outreach. I don't know if you've seen our new. Yes.
Yes.
It's
Yeah,
fantastic.
the
isn't
billboard.
it? Our billboard. So just again, going back to the qualitative data grant that we had using COVID era dollars went to support this outreach for our family planning clinic. That money was rescinded. We thankfully had already encumbered the costs before it was clawed back. But again, using those federal dollars in a way that continue to bring people back into care, back into clinic.
And so the billboard switches sides,
It does.
like tomorrow or something?
In a month. So
Oh, in a month, okay.
it's 1 month going one way and then 1 month going another way.
Okay,
So,
interesting.
and previously we had one out on 25. I feel like we might have had one more, but it's not coming to me right off the top. I apologize. But again, all using these same qual data COVID era funds. All right. And then wanted to share just a fantastic update for our DAT cap licensing. So talked to Amy today when she finished up her inspections today. We are at 100% of our required inspections being completed, and we are still sitting at about 70% of those complex. You guys will remember that we are pursuing the FDA voluntary standards. We want to create a culture of food safety. And we understand that one and done inspections, especially in high complexity restaurants, isn't maybe sufficient. And so we're at about 70% of seeing them twice a year. So that's all good news. And then I feel like there was one other thing that we need to talk about. I'm sure we'll get to it. Any questions about the staff report?
Yes, Supervisor Bashan, thank you.
More of a comment. I heard earlier today that when looking at food share dollars, market match, and the farmer's market, Dunn County actually ranks 6th in the state for the usage of the market match food share versus how many people are on it. So that's pretty impressive that we're using those numbers to our farmer's market.
Sure.
But then if we're getting those benefits cut, that's also less money for the vendors at the farmer's market.
Yes.
So it's a hit for both the person needing the money or needing the food
and
the person providing the food.
Yep. Supervisor Bjork for a very long time asked how many dollars did we get into the hands of local farmers? And so just recognizing that it does go both ways.
Dr. Hull.
Along those lines, I mean, I'm sure we all saw it, but it really just caught my breath that the decrease for purchasing fruits and vegetables went from $26 to $10 for children, from $47 to $13 for pregnant or postpartum folks, and from 52 to $13 for breastfeeding women. Now, I remember when I was nursing, I ate a lot of calories. Right? That was a time of really high nutrition needs. So this is devastating to me.
And to add to that, our farmers market dollars, last year we were able to give this per family member instead of per family. So this is now per family and then because there was such a late start, if we don't expend all of it, folks may be able to come back and get a second round, but not like we did last year. And again, these are high nutrient density foods that support a whole ecosystem of economic and whole person wellness.
Do you want to talk about the Vital Strategies grant, or would you prefer that we take that up when we do the action item?
So you have kind of it's at your discretion, of course, but it is agended at 10B, I believe.
It is. I just wondered if you wanted to do
Sure,
sort
absolutely.
of an update outline. So what we're doing is approving a letter. And so some information about the grant would be, I think, a little helpful.
All right. I always get that little, can't reach my tabs because it's being hidden by the share button. Okay. And so our health educator, Lindsay White, is also online. She has been the force behind coordinating this and supporting the opioid settlement group here in Dunn County to work collaboratively and in an informed manner to put forward initiatives and strategies that align with the funders' desire. And so what you have in your packet and what I have up online is just some overview background on what Vital Strategies is proposing. And it is to match dollars that we will use here locally of our own Dunn County opioid settlement dollars. They have very clear-cut ideas of how they want to use their match dollars. And so some of the things that our team really would have liked to supporting our law enforcement and other places did not align. So there may be other things that we put in the opioid settlement dollars through Paula and the team that are not reflected in this grant application. But for the funder, we really tried to focus on things that were harm reduction focused, that supported people living with substance use disorder in early and active recovery. And then also to support folks with co-occurring mental health concerns and substance use disorder as well. So typically we don't bring these things to you. We make a lot of grant applications without your awareness. But this one specifically asks for a letter of commitment from the governing board. And if there is that letter of commitment, you have one that's draft provided in the packet, then both Paul and I will work to put that into our budgets for 2026 so that we can, if we're funded, meet that commitment. Any questions?
Yeah, and we'll act on that later, but I thought a little background would aid our decision-making. Supervisor Hagan?
Thank you. I just had a clarification question, I suppose. Under the frequently asked questions, it talks about matching funds, new programs and everything like that. With the letter, with the 1 through 5, do we have to specify that a program is going to be a matching fund program, not necessarily fully funded by all that, or is that getting too in the weeds?
It's too in the weeds.
Okay, thank you.
I would say all 5 of these are requesting a match.
Is that what like Vital Strategy needs to know with the letter?
Yeah.
Is that something? Okay. That's all. Thank you.
Okay. Anything else? Yes, Dr. Hall.
So just really quickly, there's a typo in the budget. Yeah. So item F is supplies. And then underneath that, it says total cost for marketing and promotions instead of total cost for supplies. Yeah, that's it.
I love it that you read things so carefully.
As you will note, we have not submitted this, so your feedback is timely and helpful. Thank you.
Do you want to do budget?
I'd love to.
Oh, you'd love to. I just love to talk about that.
So you know that once a quarter, we do get you a full budget. So you
Of
have
course.
all the pages. And it can be dizzying. That was out in what Cassie had sent. So you did have a little bit of time to snuggle up. So I'm not going to pull that up on my screen. So walkaways there are a couple things that I want to flag for you. One is that we are scheduled to use about double what we had budgeted for our public health infrastructure grant. You'll remember that this is a 5-year grant, and it really was to support innovation in infrastructure. Unfortunately, due to the clawbacks, we have had to reallocate some of our staff time to that grant. To the tune of, we're going to look at about 40,000 for the end of the year instead of 20,000. This grant is, again, a 5-year grant where we've only spent what we've spent currently, and it is a total grant of about $161,000. So we will use a good chunk of it this year and then have about 116 to 90 or so to use next year, again, to just support the same kind of needs when we already know we have some grants that are rather pass-through contracts from the feds that are cut, and we want to keep people whole. A couple other things that I'll lift up for you. We are showing more revenue in both our water lab and our reproductive health clinic. In repro, I hope that holds. You will know that we have an amazing public health nurse right now who is out on maternity leave. We cannot wait to have Megan back. She'll be back in July. My hope is that will continue. That is the whole effort behind the billboards, the rebranding, the making sure that people are out there, is that we can get back to meeting people where they're at and getting them the services that they need. So my hope is that holds. With the water lab, I believe that will hold. because
Right.
we are partnering with Land and Water Conservation to do their water testing.
Mhm.
And we were just notified through email that Pepin County is also planning on using us for their TN.
Yay.
So our hope is to build that business base and support that program in its entirety. The first year, if we can do it out the gate, that would be amazing.
Did you see the video that they put out about getting your water tested?
Wasn't that wonderful?
It was wonderful. It was just hilarious. Goldfish.
So if you haven't seen the county's social media footprint, our IT folks have had just a lot of fun showing maybe the lighter side of Dunn County employees and kind of how we engage with the community. And so if you have not seen Heather Wood and Chase Cummings from Land and Water Conservation and Anastasia
Anastasia
Struber from HR kind of role play the importance of getting your water tested. It will make you laugh and hopefully will help you remember that you should get your well water tested every year, and you can do it at the health department.
I thought it was totally hilarious. I loved it.
Fantastic.
All right.
Any other questions
any
about
further questions?
finances?
Budget? Okay, thank you very much. We're moving on to human services. Paula, it's in your court.
Good evening. You received my report in the packet where I highlighted many activities that are going on within or have been going on in the department. I will just highlight a few. I informed you that the Choices Grant or First Episode Psychosis was not funded for 2026 or thereafter, which was really disappointing because we've a lot of work and energy has gone into that program. And you'll see a letter in the packet that Sarah sent out to our partners through RWC Recovery and Wellness Consortium talking about that. Now, that said, that grant really supports training, it supports supplies for consumers, it supports things that CCS is not able to pay for. And it supports persons that are not Medicaid eligible. And so about right now, I would say 70 to 75% of our participants are Medicaid eligible. And so what it does is, those that aren't would not be able to be in the program unless there was a county out of the consortium or Dunn County individually that felt that being in this program may help a high cost placement. And we may choose to use some of our behavioral health funding to support that person, even though they may not have Medicaid. Now, that may be one example of that because of the psychosis issues that are going on with individuals. For those that are in CCS, they would have a CCS case manager, and CCS has a provider network of providers that provide services, and Dunn County is a provider, such as our clinic, and FEP right now is a provider. And so what would happen is those that have Medicaid, if they would want the service, our FEP team would be a provider. And so we would receive funding for the billing of that, just like we do with our therapist or care in our clinic and those kinds of things. So we would hopefully support the program through that. But time will tell. Moving into this, it just will look different. And again, without a lot of those really flexible funding to do things for people, it just won't be part of that. So be aware of that. We're already trying to put plans in place and, navigate this as to what that would look like there. You've seen lots of fun things in the report, such as pictures of the ADRC meal program with Our Savior's Lutheran Church. How fun is that? They're doing some great things there for caregivers. Greg mentioned the symposium that we had, the mental health symposium, and the best way I can describe that is the game of life. Staff were given family dynamics and asked to go around to the providers that were participating in that. And one of them was veterans, one of them was like the free clinic or peer support or other types of providers in our community, and talk about what services their program or their programs would have available for these families. And so it made it kind of fun as in the game of life, but yet it was a real way to engage and build relationships and understand the programs that providers have. And so we're very appreciative for providers participating in this. They volunteered to do that. Let's see here. I wanted to share, and this isn't in the document, but we have done a lot of work in Dunn County on performance management in the last year to 2 years. Some of you are aware that there's been training provided on fierce conversations, which is a model that helped department heads and managers be able to have crucial conversations, to be able to talk about performance, to be able to have some tools in our tool belt to be able to work with staff on performance, and really highlighting the need for this. There's been changes, as you're probably aware of, in the evaluation tool and that as far as conversations and what that looks like. In our department, we've also made some changes based on our strategic plan as to how to document some of that on an ongoing basis, what that looks like, providing consistency for staff. So for example, one of the things is managers will go out and do a home visit with every staff that does home visits.
Right.
And so it's really watching staff and then giving critical feedback and having those conversations and talking about, okay, maybe there's a need here. This is what you did well. And so there's just really a lot of examples, and quality assurance, reviewing notes and doing all those things to make sure those things are timely. So it's been a real focus of not only Dunn County, but our department, and wrapping all of this in and where we're going with that. So that feels really good and solid. And I'm
Good. Thanks for sharing
very
that.
appreciative of the HR department, and especially Sarah Stansberry for her training. She's an excellent trainer, and to be able to provide that here and that support has been amazing. And so I wanted to lift that up. Also, some great collaboration happening, and I'm not just saying that because Greg's sitting here next to me, but I'm gonna say that
Because he hits you.
yeah, I met with Tracy Fisher this week from the ADRC, and she says, oh, by the way, Paula, I met with Greg, and we're going to start putting a Veterans Corner in our ADRC newsletter to be able to let people know what's going on in the veterans programs, and that many of the times we have light consumers, right? So some information being able to be shared in both ways there, and just really enjoying that partnership. And then looking at a financial exploitation awareness training for community and veterans, and that, and really setting those stages for that. And I mentioned in my report that I've been stepping into the APS
Yeah.
manager role. Well, I'm seeing all those reports that are coming in and what's being impacted with financial exploitation. And it is crazy what's going on there. And those reports coming in, the financial institutions keep sending us the reports and the impacts. And so I'm really excited about that because I know how much that is needed. So that's exciting. Last thing I want to lift up is RWC had what they call a crew event where providers and the staff come together for a day of learning. And Dr. Hall was one of the presenters. And it just so happened that part of the performance review is for me with the managers is I go to one of their team meetings and give them feedback on their management skills and leadership skills in the team meeting. And I had the pleasure of being at the team meeting the day after the presentation. So I heard all of the feedback about Dr. Hall and their gratitude of really looking at the topic from a medical model and the research based with that. And it's not, sometimes you can look at topics by feelings or, culture, those kinds of things, and just the appreciation of the medical model and how wise you are and bringing that to them. And so they just really lifted you up. So I thank you for providing that presentation. That was amazing. And then you'll see that one of our staff received an award for her support to consumers. So I think that is it for my report.
You want to
Any
do
questions? Yep.
finances?
Finances next. Well, you may look at the document in here and celebrate because it looks a little different than last month. And then, so we received information that the youth that is in Lincoln Hills or Mendota combination with that is going to be released and back into the community in July. And so this was with that projection in there. And then we received notice that the services to keep them in the community are going to be about $30,000 a month. So that's not added to this. The placement was 38,000 a month, and now to bring him back out and to put the needed services in the community to keep community safe and him safe and engaging back in is about 30,000. So you can add about 90,000 onto these projections as expenses because I just got that like a day ago, and so that's not added
Yeah.
into here. So you'll see
Yeah.
that reflected in the projections next month. Still 344 or somewhere in there is not as bad as we were thinking, but it's still certainly not what you're used to seeing in other years. So we'll just keep looking at that and aiming for revenue sources and seeing what we can do, but that's kind of where that's sitting.
We don't have much choice. Oh,
Any questions
Questions?
on the finances?
any questions for Paula?
I was like giving lots of good stuff too.
She gave you some happy stuff.
Yeah. Thank you.
All right, thank you. And there are many reasons why we appreciate you, but we just found out about another one, so thank you. All right, action items. Moving on to 10A, a review of the DHS May 2025 vouchers paid. Does anybody need any clarification of this? We look at them every month. So the total this month is 676,394.43, $676. Any questions on any of that? I need a motion to note review.
So moved.
Dr. Hall, is there a second? Supervisor Steen seconds. Any further discussion? You have this in front of you. All right, all in favor of noting review of the May vouchers, signify by saying aye. Aye. Any opposed? Vouchers are noted. Second item 10B, we've already discussed a little, is a letter of commitment on the Vital Strategies opioid settlement grant. You have the letter. Does anybody want me to read the letter? All good on the letter? All right, it's a letter. It's an official commitment of the Dunn County Health and Human Services Committee to earmark a portion, et cetera, et cetera. All right. I need a motion to approve. Supervisor Breslin. Mr. Lamb is the second. Any further discussion? Any questions? If not, all in favor say aye. Aye.
Aye.
Any opposed? The letter will get signed. Mr. Lamb seconded. You know, I get this kind of constant feedback in my ear. All right, final item is a Veterans Office budget adjustment. This comes because we got a huge increase in the Veteran Services budget. Do you want to talk about this, Greg?
Just quickly, this is just an increase, of course, because we turn in our budgets that get approved November. We had an increased population in Dunn County that pushed threshold up by 2,063 from typically what we have. So this is that long-awaited increase and request to add that into the budget.
Yeah, $2,063 increase to the budget. I need a Supervisor Steen moves approval. Supervisor Bashan seconds. Any further discussion on this? All in favor, say aye.
Aye.
Aye. Any opposed? All right, the budget adjustment for Veteran Services Office is approved. And unless we have announcements or anything else, If not, thank you all. We are adjourned.